Sky Health is not just a platform, it's a movement, a mission to inspire, educate, and empower individuals to lead healthy and happy lives. Our mission is to create a world where health and well-being are not just dreams, but achievable realities by everyone.
About, if you assume that you have a population of about 100% of 100 people having, diabetes, 56 out of those 100 will not be aware that they actually have diabetes. And this is Kenyan statistics. I've seen patients. The moment you are, these are diabetic patients, and you are using oral medication, and then you introduce insulin, then they interpret insulin is a death sentence. So they think, now I can stop the drug, seek for divine intervention. The right way should be, if you're working during the day, you then take a heavy breakfast. You eat your breakfast like a king. Then you take your lunch, like a prince. And you take your dinner like a pauper, like soda, and someone just take a 300 ml of soda, whatever brand it is. You are feeding your body, yes, with carb for it to use, but a lot of that sugar is going to be stored. And that's now we cross the gap of just providing carbs, and we cross the gap into asking the body for more insulin to regulate this glucose back into the cell. So if the insulin is not enough to get the sugar back into the cell, then we are also now giving the body a problem. So when it's being stored, obesity becomes an issue, especially trunk obesity. So you find someone with very poor eating habits, but they big tummy. And now that trunk obesity, you increase the surface area, then you need more insulin, and with that more insulin, pancreas is not able to produce, then diabetes ensues. So we are doing a study on among diabetic patients, which is an advanced stage. But we are looking at that study. We are looking at diabetic foot disease. But the question is, why diabetes? And this was my own grandmother. My own grandmother lived with diabetes for 25 years. My maternal grandmother for 25 years. And since when I knew myself, I knew that my grandmother is diabetic. And she passed on a couple of years ago at 77 years. And out of those 25 years, she managed her diabetes appropriately. This man, we just realized that he is diabetic because he had an unhealing wound in one of the hospitals that I practiced. And tested, and fast forward, long story short, we had to have the leg amputated or the limb amputated because, the complications were too much. Before things went further, we realized that they actually had a kidney disease and an eye disease. Because they actually moved together, the eye complication, the kidney, and the diabetic foot disease, and among other things, including blood pressure, that we need to eat organic foods and traditional foods vis-a-vis processed foods so that we can prevent ourselves from diabetes. That's amazing. Is the aspect of sugar. Because I've seen people say, because of diabetes, I'm not going to take white sugar, we'll take brown sugar. That's a fallacy. Number two, I will take honey. Instead of putting sugar, I will take honey because honey is organic. To be surprised.